If you struggle with some low back pain that's kind of coming from this area right here and not so much the mid back, don't blame your low back at first. It could be some other factors around there, such as your upper back or your T-spine, and then also your hips. So your hips are supposed to be really nice and mobile, okay? And if they start to tighten up, then movement starts to happen in the low back more than we really should aim for, and that joint is supposed to be a lot more stable. So one thing I want you to think about, you can really focus on working on your hip range of motion with something like a hip circuit. So you're driving back, swinging out to the side, back out and down, really trying to work on a full range of motion through your hip, really working on covering as much ground as you can while keeping a stable lower back. Because again, the problem is the hip might be too tight. That's causing a lot of low back pain, especially when you do things like squat or sit down in a chair or try to get out of a chair and you feel everything seizing up. It could be a lot of that hip issue. It could be a lot of the upper back as well, or that mid back, your thoracic spine region in particular. Another one you can do, you're sending the foot out to the side, hinging down, coming back up, hinging down, coming back up, really focusing on controlling your back position again, because that's the problem area, remember? So we're trying to fix that by getting a little bit more hip range of motion throughout, so we don't have any sort of back pain when we're squatting, or if you go into a flip turn in swimming and you feel everything seize up, or any other activity where you have to squat down into position, think a catcher in baseball, you name it. We need to work on that hip range of motion to make sure the low back takes the load it's supposed to, but nothing more.